Hello, everyone. Welcome to YWCA Greater Green Bay and our Stand Against Racism series. YWCA Greater Green Bay is on a mission to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. And we are so grateful that you are all able to join us today for our Stand Against Racism series. Stand Against Racism is a long-standing lunch and learn series here at YW, and moving over to virtual this year has provided us with some different opportunities to reach people, and we're really excited about that. So this year, our Stand Against Racism series has been split into two parts, kind of every other month. With some months, we're focusing really in on systemic racism and the kinds of historical policies and procedures that have created disparities within our country. And then the other half of our series, which is what you're joining in on today, is about how specific cultural groups are responding to and being impacted by COVID-19 and the realities of 2020. So we are so excited today to have with us two guests that I will let introduce themselves. So Maria, thank you so much for being here today.
Thank you very much, Andrea. Certainly happy to be here with you and all the individuals who have joined us. As you said, my name is Maria Lara. I am a volunteer at Casa Alba Melanie. In addition to that, I teach part-time at YWCA at the College of Business. I've been here in Wisconsin for about 8 years now. My previous employer, Schneider, brought us here, my husband and I. He still works for Schneider, and I had the privilege of working with them for 20 years, both in Michigan, a little bit in Mexico, and then here in Wisconsin. So I did retire about 3 years ago and now spend my time teaching and volunteering at various organizations, including Casa Alba. So thank you.
Thank you so much for being here. We really very much appreciate your voice in this conversation. And our other panelist today is Yolo Diaz. Hi, Yolo, welcome. Thank you so much for being here.
Hi, Andrea. So yeah, my name is Yolo Diaz. I am a pediatrician at the NEW clinic. I was born and raised in Mexico City. That's where I went to medical school, then moved to Miami to do my pediatric residency. Went back to Mexico for a couple of years, really tried, but the high rate crime pushed us to come back to the United States. We're immigrants like many of the Hispanic community. And I've been here for 20 years. We made Green Bay our home. And since then, I've worked for the NEW clinic and with the Hispanic community. And in those 20 years, I have also participated in many boards and committees representing the Hispanic Latino community. And I appreciate your invitation, and hopefully we can make this a very good conversation.
Yeah. So I'm Andrea Hugenbeck. I'm the Social Justice Program Specialist here at YWCA Greater Green Bay, and really focusing in on bringing these kinds of conversations into our community and really increasing the opportunities that we have to be able to hear different voices and explore different kinds of topics around race and ethnicity and disparities and different kinds of cultural assets that people are bringing to our community. So again, all of you out there into the universe, thank you, welcome. And Maria and Yolo, again, thank you so much for joining us and for being part of this conversation today. So starting off right off the bat, we want to talk about preferred language and identity markers and kind of what that means, what is important to you, and what kinds of identity markers do you use, and why that matters. So Maria, do you want to get us started off with Latino versus Latina versus Hispanic versus Latinx versus what does all of that mean?
Yeah, those are a lot of options. And I'm glad that you brought this question up because it is something that I think some individuals have wondered about. Myself, I self-identify as Mexican. I was born in Mexico. And I think it'll help if I explain why I identify that way. My family and I immigrated to the US when I was about 1 year old. So in 1972, we left Mexico seeking economic opportunities and education. We were a family of 5 children at that time, and we settled in South Central LA. At the time, South Central LA was primarily African American, It was one of the few places where African-American families could purchase a home. So families who worked in the manufacturing industry in Southern California, in South LA, were able to settle there, beautiful homes, palm trees, wonderful weather. But growing up, my first language was Spanish, and we listened to music in Spanish. Vicente Fernandez, for example, was very common to hear in our house. We had piñatas at our family parties and tamales on Christmas. So there was never any question that we were Mexican. Again, we lived in a primarily African-American community. So, you know, I was very fortunate. I grew up in diversity. And my family actually lived, we lived here in the US undocumented for about 15 years. So it was very easy and natural for me to identify as Mexican the whole time. When I went to high school in East LA as part of a college incentive program, I started hearing different terms. In California, you heard Mexican-American, Mexican, and Chicano, which was new for me. And the term Chicano and Chicano, Chicana and Chicano was new because, again, primarily African-American community where I grew up in East LA, long history of Mexican families. It was part of Mexico before the 1846 Mexican-American War. And it was a place where there was a lot of political activism. In the late 60s, there were walkouts by the Chicano students protesting the way that they were being treated as students, being channeled to more manual labor type careers instead of college. The dropout rate was pretty high. So it was more of a political term. Fast forward at UCLA, also used the term Chicana and Chicano very commonly. In fact, they have a wonderful Chicano Studies department that was developed further in the 1990s when I attended. And when I moved to the Midwest, again, still identified as Mexican, never really took on the label of Chicana, although politically I'm more aligned with the Chicano identity, but still identified as Mexican. I went to live in Mexico City for 2 years in 2011 with my family as part of an employment opportunity for my husband. And you realize when you go back to your country of origin that you've been away for so long that you become Americanized, you know? And it wasn't until I was in Mexico that I realized that. Still spoke Spanish, but obviously having spent so much time in the US, there were some differences. Here in Wisconsin, I still identify as Mexican. I didn't become a US citizen until 2004. So having lived here undocumented, not being a US citizen for much of my life, I still self-identify as Mexican. Again, my politics are probably more aligned with being a Chicana. The term Hispanic is something I was familiar with, but has negative connotation on the West Coast at least. And the term that I use when I'm referring to the community here in Wisconsin specifically that is made up of Mexican, Puerto Rican, Central American, South American, I normally will use the term Latina or Latino community. So that's a very long answer, but I think it provides a little insight into why some people choose different labels. It's either what they're familiar with, what they grew up with, and also sometimes, you know, political reasons. So Latinx it's an emerging term. It's used more in the academic world and by the younger generations. I do like the fact that it's an inclusive term and is gender neutral, which I think is wonderful. I have not gotten on board yet and used Latinx, but I'm very flexible, but personally, I still identify as Mexican.
And Yolo, do you have additions?
Oh, well, yeah, I will say that when I moved, I was also always Mexican, living my whole life in Mexico. When I moved to Miami, then the term Hispanic is what I heard, and that was the community I was part of. And then when I moved to Green Bay, it was also Hispanic. So until, and I will confess, Maria knows, until this discussion, I didn't, when Latino was introduced, I was like, why are you changing all of a sudden? You want me to get myself into another group? But I didn't take into it, but I didn't even realize what was the situation behind it. So because in the regions that I've lived, Hispanic has been the main term. Then through habit, that's what I use. Now that I have had the opportunity of learning why Hispanic, why Latino, again, as Maria says, then Latinx, again, are you gonna switch me again? It's kind of difficult. It would be a conversation in itself, how we feel. But anyhow, but the only thing that I can say is that by habit, and because the regions where I've been, it's what it's used. I use more Hispanic than anything else, even though I understand Latino. Latinx, again, as Maria says, I haven't really gotten into it, but that's what you will hear me referring more to, Hispanic.
And I appreciate that so much, and appreciate hearing you talk about kind of the evolution of these terms and the regionalism of it and how it can be complicated. Because I think a lot of us who have very little interaction find it to be really complicated and don't want to like screw it up, but also like really just don't know what we're talking about. So I very much appreciate that commentary from both of you.
Sure.
So as members of the Hispanic or Latino community here in Green Bay, can you share your experiences of your time here in the Green Bay community? How has it changed over time? How has it been welcoming or not, or maybe some of those issues?
So I live here for 20 years. This has been my home for 20 years, and I've been lucky that since I arrived, I was able to work with the Hispanic community. That's my the population that I take care at the NEW clinic, and it's really good. And of course, because I was from the beginning in the Green Bay downtown area, I could see the large presence of the Hispanic community there. The population has increased, it has doubled. When 2000 census was around 9,000. In the 2010 census, it's almost 19,000. So definitely it's a growing population, and you can feel it. I mean, we're a minority, but we're loud. We like partying, as Maria was saying. So of course, when I got here, I thought I was not gonna be able to prepare the food that I'm used to, and that was not the case. Sometimes I can find things that in Mexico they can. I like the Mexican tortilleria. The tortillas are even better here than in Mexico, I think. So there's the Mexican markets, and there's the bakeries, and there's definitely the community is present in Green Bay, and so mainly in the downtown area of Green Bay and also in Bellevue. And there's other people, there's other part of the population in other areas. I realized right away that the communities, the Hispanic communities, very family oriented. They rely on families. I remember when I started working and I started realizing how many families were living in Green Bay. When I moved to Green Bay, the first question was, why there? You come from a warm place, and why? And my answer was because of a job. So I would ask my my patients, the families, I say, why Green Bay? And the answers that I got most of the time is that the fathers would initially arrive to the larger cities, maybe in California, New York City, even Chicago, a lot of times Chicago. And when they decided to bring their families, their wives, their children, and eventually their brothers and their mothers and everybody, they realized that coming to this area was a good choice because there's less crime, the cost of living is lower, the schools are better, the education, they realized it was better education for the kids, and there was jobs. A lot of them work in the manufacture, most of them work in the manufacture industry, in the meat packing plants, in the paper mills, in the um, and some of them also work in the service industry, and you can see the presence there, and of course in the dairy farms. So definitely I saw right away the incredibly hard and beautiful work ethics that the community have. They're here to work and take care of their children. It's very important to give education and a better outcome to the community, to their children. So those are all bright aspects, but I also learned very fast that it's kind of um, the golden cage, as we call it. In Spanish, it would be la jaula de oro, because um, uh, a lot of the members of the community have some kind of immigration issues. They are working towards a status, and unfortunately, immigration has become politicized. So it's like, to me, it's like immigration comes to the table when there are political campaigns, and so they start making changes and promises, and then the elections happen and the community is left either with less that they have. For the most part, they been losing privileges. They lost the possibility of having a driver's license. They feel more persecuted. There's, for the most part, negative changes. So that makes life difficult and scary for a lot of them. They are constantly feeling persecuted, and that's very sad. I do, so that's what I've seen. And of course, people coming and coming. I could see more families, and it's reflected on the census and on how many people we have. One bright side that I experienced along all the changes that are promised for immigration, it was when DACA came. When DACA came in 2012, I saw a beautiful shift on my patients that were of high school age. Before DACA, I could see those kids would start getting withdrawn, would start getting apathetic. They didn't know where they were going. They didn't know what they were going to do. They could see that the United States is the place of promise and of higher education, but they didn't have a path to it. So it was sad. I mean, I could see that. And all of a sudden, DACA came in and we started working, and I started seeing my patients coming back, and they were completely different. Their faces were they had a glow on their face. They were telling me that they got their driver's license and they were working because they had a work permit, and they continued working, and they had a plan. So that was beautiful. That was a beautiful change that I could see. The other important change that I've noticed, and again, this is only anecdotal of all the community that I work with, this administration, of course, things got worse that I've seen. The persecution got worse. The promises of closing the borders and making things really difficult and was horrible, and we know it. So I did notice that the influx of especially people from Mexico, that's the part of the population that Mexicans contribute to the higher numbers in the population, kind of stopped. Those families that I was mentioning before, I saw that they were not coming as fast as they used to, but it shifted. I did notice that because of political asylum, an influx of single mothers with children from Honduras, from Nicaragua. And of course, the pandemic hit soon after, but I'm a little bit concerned because these women come without the that support that I was mentioning of families, they come by themselves. And I could see that the children, their health and their behavior and their needs were greater, and there was less support. So that's something that we'll see what happens, because again, as I tell you, the pandemic hit and we haven't been able, I haven't been able to see what's going on. But those are the main changes that I've seen in the community.
One of the things that I've heard from many of our clients from YW is that their churches have started having Spanish-speaking services, and that the feel at those Spanish language services is very different than they are at the English-speaking services, and how much people have really appreciated being able to have that other option, and particularly in services where even for people who don't speak Spanish, like they know enough of what's going on to be able to still participate and appreciate the service. But just that it has, both of you noted this sort of piece of, celebrations and being sort of joyful, and people have really appreciated having services at their church that have that more kind of joyful vibe to them, and how much that has really added to their experience here in Green Bay and their experience in their church, which I think is such a beautiful thing to notice, that having Spanish language people participating in your church really adds something that's really like beautiful and rich and can be enjoyed by everyone. And those kinds of pieces where we can really take note of people adding to our community, I think is really beautiful. So I wanted to throw that one out there. So as leaders in the Latino and Hispanic community here in Green Bay, how have you seen your community impacted by COVID-19?
Yeah, that's an important question. I think, there's a number of ways that every family, regardless of who you are, who your ancestry is, or what your ancestry is, has been impacted in one way or another. But we know the impact varies depending on a number of factors. For the Latino community, what I have seen is the social impact. You mentioned some of the festivities that individuals have noticed in churches. Those are very important to our culture. It's a very colorful, beautiful, lively culture. So not being able to have some of those religious gatherings or those celebrations like a quinceañera, for example, when someone becomes or turns 15, not being able to observe the Day of the Dead in a traditional way, which is done at some of the local churches, is very, very difficult. So that social aspect is very tough on people. There's a number of individuals, Dr. Yolo mentioned, that have come here from other states in the US. Much of my family is in California, so not being able to fly out there and see them is very, very difficult, especially my mom. And I have a sister in Illinois who I also have not been able to see. So that aspect is very tough, I think, for a lot of the Latino community who has extended family outside of Wisconsin. As it relates to COVID, certainly the practices and rituals that we have associated with burials has been something that has been put on hold, and that's obviously extremely painful for a lot of people. Everybody has lost, well, a lot of people have lost someone that they could not see in their last moments. But even after that person passes away, not being able to bury them in their cultural or religious practices is very tough on a lot of communities of color, including the Latino community. In terms of education, certainly the digital divide, as we call it, has affected Latino communities. The Green Bay School District has been closed for a very long time for safety and health reasons. But many of the children there in the younger ages did not have a device last school year. So when the school was abruptly ended in person, many of those children did not have the devices they needed in order to continue their education. Similarly, a lot of their parents who not only work and manage a household, they also attend English classes at Literacy Green Bay, for example. A lot of those parents have had to put their education on hold. The kids now have digital devices. The school has done a lot. The Green Bay School District has done a lot to connect people with resources, whether it's Wi-Fi devices, the know-how to carry out virtual classes. Some of the parents have been able to attend English classes virtually, but of course, having to support their children has placed their education on hold. Financially, I know that we'll talk a little more about that, but certainly financially, there's been a significant impact to the community. A lot of our community doesn't have access to healthcare or insurance, and that has been very difficult. They also were intentionally left out by the state and federal government in terms of stimulus checks and other safety nets that other families have. And certainly just the overall value of the Latino community is often, questioned. The US government, the community, unfortunately, has often used communities of color, including Latinos, as scapegoats. And after what we saw at the border crossing, the separation of families, that was just heart-wrenching, certainly. And we know that that's not over yet. We know that there are families that are being forced to live in very difficult situations without having the opportunity to be able to further their asylum cases, for example. So that's been really tough. And even if someone like me, who is now a US citizen, sees that, I know that I was undocumented in the US for a long time. I know that historically the Latino community has been scapegoated. You go back decades and decades, during the 1930s, for example, the Great Depression, many Mexicans who were US citizens were forced into traveling back to Mexico and essentially forced out of the US. So this is not new, but it's heart-wrenching when you see it, at this point in time. And certainly knowing that many people of color are overrepresented in these jobs that we now call essential jobs, but knowing that we're not receiving the value, the respect, the benefits that other individuals are receiving, those are all very painful things to have to experience. We have family to fall back on, we have our culture, religion, and so forth, but certainly that is a significant impact in terms of the COVID-19.
For sure.
So I will add two things. One of them just came yesterday. Of course, I'm going to talk more of the medical part, but the other thing that I've experienced with, and that again, as Maria says, I am documented. I have financial stability, but still, I worry tremendously, like a lot of the people in my community, about the people that are back in our countries. That's really tough because we know the reason we're here, it's because we were looking for something better. And we did come and find, for example, better healthcare. And I will talk a little bit more of that. But the way the healthcare establishments in our countries are dealing with the pandemic is really sad. It's really poor, and we all have families there, and we don't know what's going to happen with them because if we're suffering in here where the healthcare is supposed to be the best in the world, our families are doing even worse there, and that's very difficult, and that brings us together again. It doesn't matter your immigration status, it doesn't matter your socioeconomic status, our families are there, and that is very hard. Okay, so I just wanted to say that in terms of how we're impacted, and again, I say we. Going back to the Hispanic community, and I'm going to separate myself again because, well, the Hispanic community has been impacted, has gotten COVID in high percentage. Of the total cases, and this was just a couple of days ago, it's been persistent, but of the total number of cases of infection in Wisconsin, 12% of those cases have been of Hispanic Latino population. And the Hispanic and Latino population is only 5% of the whole Wisconsin population. So definitely the numbers are high for our community, and it is a lot because all of the most of the Hispanic population are essential workers, and they did not have the chance of staying at home. They had to go to work, and we'll talk a little more about it. But the manufacturer industry was not ready. They didn't have the protocols in place, and the Hispanic population got infected very soon. And now the surge is up. We have the second surge, and this everybody is impacted, and the Hispanic population continues to have a high rate of infection. So from the medical perspective, that's where we are.
It was heartbreaking for me at the beginning of the pandemic in March, April, and I feel like I don't even know what day it is at this point. Like everything is just sort of smooshed together in a very strange way. But it was so heartbreaking to see the infection really just running rampant through particularly meatpacking facilities, and how really very underrepresented and how very little power people who worked at those meatpacking facilities had, and how very sad that was to see. Can you talk a little bit about those overlaying economic impacts within the community, and how that has affected and impacted what it's like to be Hispanic or Latino during the pandemic?
Sure. We received at Casa Alba Melanie, we started to receive phone calls from families that were in need of not just financial support, but moral support also in early April. Many of us in the country knew, unfortunately, that the virus it was a matter of time before it would reach the US. It was a matter of time before it reached Wisconsin. For those of us who have family on the West Coast, started to hear about some of the implications of the virus in March. And some of us even lost extended family members in March who were on the West Coast and saw the virus before the Midwest did. So by April, everybody essentially had heard that the virus was in the US. It was just a matter of time. And unfortunately, as you mentioned, a lot of, and Yolo mentioned, a lot of the employers just weren't prepared. Some were, many weren't. Certainly the food processing manufacturers were not. And in April, we were getting phone calls from families who were desperate, trying to figure out what to do. They knew they had to work. They knew that financially it was a necessity. Their kids were starting to spend time at home through virtual learning, but they were very torn. There was one family in particular, husband and wife both work in the meatpacking industry, and they were both very worried. They had lost somebody in the West Coast, a mom, and knew that the virus was potentially very, very dangerous and lethal, in fact. So the husband was able to work through his emotional struggle and go to work, but the wife was still grieving, the loss of her mother, who she could not go and even see or bury. So knowing that her mother had passed away from the virus, and knowing that her employer did not have the proper PPE and protocol was very difficult for her. And she thought about her children and the fact that she might bring the virus to her home from work. So she contacted us, and all we could really offer, she was financially stable, but all we could offer her was really that moral support to help her work through that fear and that just the vulnerability of having to go to work, but knowing that she was exposing herself and her family. Many of us reached out, not just Casa Alba, organizations like LULAC and others reached out to companies that are supposed to be there to protect workers during these times. OSHA, for example, other agencies. And honestly, we didn't have the type of support, help that was needed during that time. So it was a very, very desperate time, knowing that there was a danger. You didn't have protection against it. There was no oversight, no requirements being placed, sternly anyway, on employers. So families like these were really torn apart. And you could have two individuals in the exact same family going through very different experiences based on what they had personally lost already in the pandemic in April. And then later in April into the summer, we started hearing from families who needed financial assistance. Casa Alba, Melanie normally does not distribute funds. However, over the spring, summer, and even today, we have been able to receive funds from generous organizations, and it's allowed us to distribute funds to families who are just financially have nowhere else to turn. Family is very important, as we've talked about in our culture, but after you've exhausted all your friends and families and your personal reserve, you have to turn somewhere, and certainly being able to turn to Casa Alba to help pay for rent or any other necessity has been very essential. The pantries have been very generous here in northern Wisconsin, so I've been very, very happy about that. But certainly, you know, the issue of healthcare, not having health insurance, the issue of economic, you know, instability, the issue of education, those disparities, all those things, you know, start to snowball and impact families in very serious ways. And certainly families who are not fluent in English, where there's a language barrier, that also contributes to the way that they experience the pandemic. The family I mentioned earlier, the wife eventually got to a place where she felt comfortable and safe enough to go back to work. Her employer started doing more to protect the workers by then. So she was able to return to work, which is fantastic, because that was an important aspect of her life. But not being able to advocate for themselves, and there being a language barrier and all these other disparities, you know, makes for a very strenuous life, especially when you know that you are, you know, being expected to be the backbone of an economy that was starting to crumble under the pressure of the pandemic.
I would like to ask that in terms of healthcare, the community has been very scared of accessing healthcare, even though we've tried to educate to the fact that if you need to go to the hospital, you have to. But of course, they don't have, many don't have healthcare access. And even if they have healthcare access, and we know it too, the bills can be really high. So there was that perception was the perception that once they got to a hospital, they were not going to be understood because of language barriers. So the community was afraid, like a lot of times, of accessing healthcare. Though I do have to say here that with almost 100% knowledge that once a Hispanic, a member of the Hispanic Latino community would access the healthcare through an emergency room, the healthcare has been the care that they receive is the same as anybody else, and that is a bright side. There is no nurse, there's no doctor that will say, oh, we're not going to give this patient the treatment. No, we can be sure that that's not the case. They receive the same care. And again, I will go back to the fact that it would have not happened back in our countries. In our countries, we can see that the patients are admitted and then the families are told, well, go buy this medication and we'll give it to them, but the families don't have the money. That's not what is going to happen here. We do not know what is going to happen with those bills. We don't know. They're going to be stratospheric, and that's an aftermath of this pandemic, and we'll have to figure out with our community how to deal with it, and hopefully support of the new administration. But they are receiving the adequate healthcare, and I do feel very proud about that, being part of the industry, the healthcare industry, and well, that's one of the reasons that we're here. So it's a bright side that I'm happy about, even though it's not nice that we are in this pandemic, and it's never good to have the virus, but at least I'm happy to know that our Hispanic community is being treated right in the hospitals.
So I know toward the beginning of the pandemic, we saw many people who are really afraid to access healthcare, and particularly testing sites for COVID, because they were concerned about immigration and being met by immigration officers at those testing sites. Has that changed? Has that impacted the response to COVID in any way? Do you know?
It was, I mean, I think we've done a lot of education, a lot of the hospitals, the health department, Casa Alba. We've made a lot of, because we knew exactly what was the fear. And the fear was that once they got tested, the questionnaires were huge and they had to give all the information. And they were like, why am I? And there was even a space to say social security number. And that was the first question. And so we had to make a lot of education. Don't answer to that, or we even convinced some of the providers of the testing to not ask that question. And we had to educate people, saying, really, you have to fill up all of that information, because there has to be contact tracing. But it was difficult. It was difficult, but I think that there has been a lot of education, and I'm seeing less our community being less hesitant on going and testing. Of course, it was very smart of initial effort, and Casa Alba was one of the sites specifically because of that, because that was where the Hispanic community had the trust to go. So I have seen that there's less of concern in that respect. I don't know what you think, Maria, but I think it's better.
Completely agree that having places like Casa Alba host testing sites was a very smart way to help gain additional trust and extend it to our public health agencies. By association, I think seeing Casa Alba working with the public health was a great way to do like a warm handoff, if you will, for some people in the community, and that's very important to do. I do think that it's been a little difficult knowing, even for myself, whenever I need to get tested, I always have to go online and figure out what are the current requirements for being tested. And those have changed a little bit, I'm sure, with the availability of the resources to test, also with the agencies that are involved, also with the information that we have. I think that continues to be a little vague, in my opinion. Excuse me, for a while you couldn't be tested unless you had symptoms. Now you're able to go in, they're encouraging people who don't have symptoms to go get tested, but the change in the messaging can be a little difficult, especially again, if you add to that, if there's limited effort to translate those messages for anybody who doesn't speak English fluently, whether you speak Spanish or any other language that's not English. I think those can be a little difficult. So certainly an area that we need to continue to work on, I think.
That's so great to hear that that perception has changed. That was such a really heartbreaking piece of all of this, and something that I think so many of us need to hear, and so many white people really need to hear, that people were afraid to go and get tested. People who were sick and were potentially infecting their families, and really like having serious consequences from a very serious deadly virus, that were afraid to access testing because they were worried about their immigration status, or sort of what that response was going to be from public health. And I think that that's a really important thing for so many of us to be able to hear that, and that fear around immigration is really impacting lots of ways that people operate, but also so many of these sort of bigger community consequences then that go along with that. So I appreciate that insight from you. What about support? How have you been able to find support? How has your community come together and responded to COVID-19?
Well, me personally, since I have not able to see my sister in Illinois or my other siblings and mother in California, I certainly find myself cooking more traditional dishes at home. Although my daughter has told me I still don't cook as well as my mom, but I definitely do try to cook more traditional Mexican dishes at home. I find myself listening to more music and TV in Spanish because I think it's filling that void for me in terms of not being able to see my siblings and my extended family in California. But also certainly being able to partner with such great organizations. So YWCA has done just a tremendous job really shedding a lot of light and spending the time and effort to get to know the various communities represented here in Green Bay. Being able to work with Casa Alba Melanie has been fantastic. I met Dr. Yolo as a result of all this. So certainly being able to lean and help and support important institutions have been, a way that I have found support. I've also been very impressed, I have to say, with the Green Bay Police Department and the churches and the efforts that they have made to overextend themselves and even, create videos in Spanish the best they could to make sure that the community feels that they are being supported by these various groups. And ideally, organizations, businesses build trust and people build trust before these really bad situations take place. Trying to build trust during a pandemic is very, very difficult. So in the ideal world, that trust is already there. However, it doesn't mean that you don't try. And again, being part of some of those efforts with some of these agencies has been very helpful to me, because I do find that, obviously self-care is very important, and I know that. However, I also find it very helpful to involve myself in efforts that I believe in, and that really helps refocus my attention and anything I'm missing to a much more positive venue.
The families have been a great support to each other. As I said, it's a community that rely on their families, and I think besides all of what Maria has mentioned, having their families here has been very beneficial for them. As you know, Maria and I don't have that privilege of having an extended family here, so we had to find ways. But I can see that, again, that decision that many of them made of bringing all their family has been beneficial, because it has helped them go through these difficult times.
Family is one of those concepts that I think so many of us really take for granted and don't recognize how very different that interpretation can be across cultural groups, and how that can be really a benefit to people in different circumstances to have that kind of different sort of flavor to who is considered family and how they interact with their families, and those kinds of pieces. So I'm so glad to hear you talk about how your families have really helped to sort of move through this really difficult time. Have you found that there have been gaps in support, or things that you wish had been available or wish were available?
Absolutely, and we talked about the some of the education and healthcare gaps. Certainly education. We talked about the digital divide and the fact that many parents are working still outside the home. Over half of our Latino community works in manufacturing, and certainly having parents outside the home doing their job, but also maintaining food in our grocery stores. That's really important, but not having that childcare or that education outside of the home has been very, very difficult. And I certainly hope that the greater community takes away the fact that many of our Latino families are still, or parents are working outside the home. It's important that their kids are able to go back to school, for all of our kids to be able to go back to school, but certainly parents who are having to leave the house to work, it's especially important for them to have their children in school. So we need the surge to be brought under control. But additionally, the economic support, I think, is very important. We have not seen any gap in the moral support that we get from our families and community, but the economic, it's a huge impact to people's lives. It really drives a lot of the opportunities that are made available to them. So I am very disappointed that the stimulus bill did not include many of our Latino community. And that was a very conscious decision. There's another opportunity, I hope, in the next stimulus bill where those families will be taken into account. These are families who may have, for example, a wife who is a US citizen, a husband who is not a US citizen, children who are US citizens. But in this case, the family does not receive a stimulus check because one of the two parents is not a US citizen. And to me, that's a travesty. And I'm not even sure why that's even legal, to be honest, because that husband is also working, also paying taxes. So to knowingly exclude families like that and not issue those stimulus checks to those families, also including, including the fact that these families are not only not getting the stimulus checks for the adults, but for the children also. So that entire family unit being left out intentionally is very disappointing. And I certainly would expect that that's going to be a topic of conversation in the next discussions that are still being had. So the economic gaps, I think, for me, are very significant.
I appreciate both of those things. I've been thinking so much recently about, all of my jobs have really revolved around a computer, and I've spent a lot of time on a computer my entire adult life. And thinking about parents who don't have that kind of an experience and trying to navigate virtual school must be an absolute nightmare for people to try and help their kiddos get connected and get online and do that digital schooling when they just don't have the same kind of experience and familiarity with technology. To hear you say 50% of our Hispanic members of our community are working in manufacturing, I didn't know that number, and that's a huge number of people who then just don't have the same sort of familiarity with technology to be able to help their students transition that way. And then also, I really appreciate that you bring up this piece about stimulus checks and also about social services and safety net services that we have in our country. I think there's a huge misconception about immigrants being a drain on our safety net programs when really, like, they're not eligible. That's not what's happening here, people.
They're providing, they are paying taxes, but they're not getting back that we know. So no,
Mm-hmm.
not a drain.
Yolo, do you have additions?
Well, the gap that I see, but it's not only to our community, but it gets greater, of course, is the lack and confusion of the information. We're all confused. The information keeps coming and going, and nobody's doing things the same way and everything. And that's a problem with the COVID pandemic throughout. But if we add the language barrier and the lack of trust to some of the institutions, then our community gets really even more confused than the rest of the community. So that's a gap. Again, it's generalized, but it has a deeper impact in our community because of lack of trust and language barrier.
For sure. So just another minute before we kind of say goodbye and sign off. Have you seen any bright spots within the pandemic and things that have been kind of good takeaways that you hope that we can keep moving forward, even if we get through this particular challenging spot in our days?
Sure. Even though it was a steep learning curve, certainly a lot of parents have risen to the occasion of digital learning or virtual learning. Also, older siblings have been very key in these situations, helping their younger siblings. In terms of just the general community, I've been really impressed with the innovation, car companies making ventilators, the development of the vaccine that we're all hopefully going to see very, very soon. So I have been really impressed with the innovation, the ability to adjust to the steep learning curve. Honestly, I'm excited about the next administration and the opportunities that will present to us. There's been a lot of reporting on the disparities. We've talked about some of these disparities, and I feel hopeful that those are going to be addressed in a more fair and just manner. So that's a bright spot for me that I'm looking forward to.
And I will just add shortly that the bright spot that I've seen working with the community and only by the phone at this point is that the resiliency is there. It was hard to get here to try to seek the American dream. It was always hard, and there needs to be a lot of strength and resilience, and our community is showing it with this new challenge.
One thing that I have heard out there is that many of my clients who have appreciated Spanish language services at their church have also commented that they feel much safer going in person to those Spanish language services because they're seeing people with much higher compliance with masking and social distancing at those services than they are at English language services, which I think deserves like a huge gold star for being able to really, pull that together and comply with those public health mandates, and really shows that sort of community spirit of people really making sure that they're taking care of each other, and that that's an important part of Hispanic and Latino culture, to really make sure that that you're taking care of each other and protecting one another, and that that's important. So I think that deserves a huge gold star out there. So Maria, Dr. Yolo, thank you so much for joining us today to have this conversation. I appreciate your insights so very much, and your vulnerability and willing to share with our community all of these different pieces. To all of you out there in the universe who are watching this both today and in the future, thank you so much for joining us and participating in this conversation, and really learning and being open to learning about these different kinds of topics. So from YWCA Greater Green Bay, thank you so much for joining us on our mission today of eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. You can find the recordings for all of our Stand Against Racism series so far on our website and on our Facebook pages. And then also you can find on our website the links to be able to register for the rest of the sessions throughout this year as well. So that is YWCA greatergreenbay.org to find all of that stuff. So thank you so much. Any final parting words?
I love the fact that you mentioned the attendance to the Spanish-speaking services. I would just encourage people to continue to learn about each other's cultures. As far as I'm concerned, diversity is a strength. It's beautiful. It's wonderful. So please embrace it in any way that you can during the pandemic, and certainly after we're past this. So look forward to seeing everybody around town soon.
Stay safe, wear your mask. We can do it.
All right. Thanks, everybody.
Thank you.
Bye.